21 Pilots, 105.1 The Buzz with Daria, Mitch, and Ted. Let's welcome to the show Dr. Dan Miller from Valley Dental Works, cosmetic surgeon. Hello, Dr. Dan.
Hi, how are you?
We are looking at my handsome husband.
I said cosmetic surgeon, cosmetic dentist. Yeah. Excuse me.
He's good looking, huh? But he needs to work on his teeth.
Oh, he's not smiling in that picture.
No, he's not. Yeah, he has teeth issues. Oh, well, a lot of them
play
are
hockey and lacrosse your whole life.
he's a goalie, so a lot of them got knocked out.
Is this not wearing the protective mask?
No, you wear the protective mask.
But you still get the blow.
Oh my gosh, yeah.
Does he have like a special sports guard?
He's retired now, but yeah, he had the mouthpiece and the whole thing and the mask. But it's still, if the ball hits you square in the face, your teeth are going.
Plus fights and
fights, yeah.
Well, they have
a lot of fights.
Retired hockey players, they don't do anything during their careers, and then they get done, and they're like, okay, I'm ready to rebuild my smile.
Sure.
Yeah.
Yeah.
His smile's good. It's really good.
He's very handsome
yeah,
man.
Yeah. But a lot of the most beautiful teeth are not teeth he was born with.
Got it.
I have a question about smiles.
Yeah.
And I know it has to do with so it's a good thing you're here.
That works out well.
I know it has to do with the face shape and the jaw shape and all the rest.
Yes.
But you know how, like, if I smile, I only show X number of teeth. Even my biggest smile.
Right.
I think I show like 6, maybe. Mm-hmm. You show quite a lot of teeth, Mitch, when you smile. It's more of a grimace.
Yeah, I'm trying to smile.
Don't ask Mitch to smile.
I'm
He
not
doesn't
a
know
good-
how to smile on command.
I cannot smile on demand or command.
Show him your best toothy smile. Isn't that
That's
like
good.
a serial killer face?
No.
That's on an ad on the website. I hope not.
It's also teeth whitening by Valley Dental Works. Thank you.
That's what I meant to say.
Yes.
No, but some people, a lot, you notice it with celebrities, they smile and they show so many teeth.
Yeah.
And it's sometimes gums and teeth, like the whole shebang.
Why so many teeth? Like, how is it all?
Why so many teeth?
Is there something with the facial,
Can you
facial muscles?
change? Can you change your teeth around to? No, I'm serious.
All right.
To show more teeth when you smile, to have a toothier smile.
Well, sometimes.
Or would you want to?
Yeah, that's a good question. So, people have different face shapes, different lip shapes. Some people have thicker lips, thinner lips. That's a big part of what people see. You can change a little bit. So for people who have sometimes very short teeth that they've worn down over time, we can actually get them a little bit more length. We can actually make that smile look a little more wide and broad. Like you think about people like Julia Roberts, right? That'd be a great person. You see about 14 teeth up there. It's
At
You
least.
see all the teeth.
amazing.
Yeah,
Exactly.
Crazy is what it is.
Bathroom tiles.
It's a lot. So, but she has that nice wide smile, and some people just don't have as much of a wide smile. But there's some things that we can do to help give them that full smile. So while you maybe see 6 teeth or 8 teeth, they're gonna look amazing. And so
Oh, that was good. That almost sounded like an ad.
it might be.
Yeah.
It's our next one.
That was actually very well structured, especially at the end.
Thank you.
And that's my partner Derek's going through at Valley Dental Works. Right now he has braces.
Yes.
Because he has ground his teeth down. He has little baby teeth now. And so eventually there'll be veneers, I guess.
That's
is the
right.
next
So we
step.
position them exactly where we want them, and then it makes that next procedure that much easier for us.
Okay, let's talk about the process of veneers.
How do they stay on for
exactly,
one thing?
that's my
Can you
question.
eat corn on the cob? And
How do veneers stay on? Do you put them on the nubs?
Oh, that's a great question. So then the quote unquote nubs
Yeah.
are
That's your teeth that
yeah,
are tiny.
The
now.
original teeth.
Yeah, but that's actually usually with people who have pretty significant crown work done. Veneers are just about the thickness of your fingernail. They're only about a 0.5 millimeter to a millimeter thick, and they actually are just the front surfaces. So your entire tooth on the back and on the top and the sides is all the same. And then if we're lengthening them a little bit, it's just the veneer itself. So the veneer is made of a porcelain, a special type of porcelain that bonds to the enamel of your tooth. And so for a lot of teeth, when we're changing up somebody's smile and the design, sometimes we have to do very little modification to the tooth at all, almost no removal, and it actually bonds. We have a material that bonds directly to that enamel. So we don't really have to reverse or take anything off. We can just add to. what
And
we
the
currently
technology for veneers has, grown leaps
improved
and
dramatically.
bounds. Because back in the, I remember
It was
in the
chiclets.
80s,
They used to be
yeah,
chiclets.
it
Yeah,
used to be
you
that-
just stick a chiclet, a white chiclet on your. I remember
but,
that.
Yeah, I remember it being that like they look good for a while, but then you could start.
Then
to
you
see
chew down
behind
and-
You got it. So the two things that have gotten
Swallow
better are
your
the
gum.
materials. But if you lost a tooth, you just put the piece of gum right back.
Right,
there.
very handy.
You got it. Very handy. The materials, the porcelain's gotten significantly better, more translucent, looks like your natural enamel, and then the bonding agents that we use are significantly better.
So they don't come off.
They don't come off. Nope. You can eat almost anything. I tell people don't use your teeth as tools, but otherwise you can have whatever you want to eat, and it's going to stay on. It's going to be just as strong as your natural tooth.
So probably everyone in Hollywood wears veneers.
I would say a good portion of people do. A good portion of them do. Or have had some sort of cosmetic work of some kind, whether that's orthodontics and whitening. Yeah.
Yeah.
I know it.
Got veneers. You guys have veneers.
Yeah.
Your teeth actually do look really, really good.
Thank you.
Because you don't usually smile with the big teeth. You're doing this to show off in front of Dr. Dan. But yeah,
It's a good looking
they're really
smile.
good.
Thanks.
Well, combined with you've been outside a bit lately, so
Yeah,
you
it's a
really
little
got
tanner.
some color.
But that glow.
You're a handsome, handsome man.
The glow
You're a
one is
handsome
very
man,
good.
and you're kind and you're dignified. So
Sweet.
okay, here's another question.
Good penmanship,
I know we're
too.
throwing a lot at you today.
Yeah.
It feels like we haven't seen you for a long time. So I wore braces forever because I sucked my thumb till I was 12. Possibly a little longer than that.
Not laughing at that.
No, it was comforting
Yes.
and benefited me later in life.
What?
That's what you were thinking.
well,
so
of
I
course.
just
Thank you.
anyway because
You made Dr. Dan red. Look at him blush.
you guys, it's your dirty minds. I only meant that I don't know what I meant.
I know what I mean.
So my teeth were straight. So now I'm how old am I?
You're a
Like
kid.
45, and it doesn't bother me, but I only bring it up as an example. One of my teeth is kind of moved around a little bit.
Yeah.
So what happens to the person that wore braces? You don't have to, if you want to change it, put it perfectly back in place. You don't have to get all new braces again, do you?
No, you don't.
Can you just tap it with a hammer?
Yeah. There's a very small hammer.
No,
Yeah.
what would you do in that condition
Yeah.
where it's like
Little rock
a
hammer.
minor
Yeah.
thing that you don't have to get the whole thing of braces for, but you just want your teeth perfect like they were right after you got your braces off?
Yeah, it's a great question. So we call that orthodontic relapse. So they're people who
Oh my gosh,
sometimes
there's a term.
who have had teeth right where we wanted them, and they just started to move back. So we can actually, through like a system like Invisalign, which we have an express case where we can do about a new set of trays every 2 weeks, and over the course of typically maybe 4 to 6 months, we can actually just gently move that tooth back to where we want it, and then we just have you wear a clear, small hammer. No, you just wear these clear trays, and you just have them in at night, and when you're not eating. And we can move those teeth back to where they were, and then we just have you wear a clear retainer at night to keep them where they are.
How
and they'll
long?
Stay there.
How long a clear retainer at night? Because I wore that retainer for, I have nightmares about my
Do you
retainer.
still wear the retainer?
God, no. My teeth wouldn't have moved if I wore the retainer.
That's right.
That's right.
They never said anything about forever.
You should get your money back. Look up that orthodontist
Yeah,
in
you
Wyoming.
gotta- yeah.
Oh, my God.
So
And
yeah,
it's like,
I typically tell people retention for life, but we look at a minimum afterwards about 3 to 5 nights a week, usually in pretty good shape.
stupid retainer.
Sorry.
Oh.
That's usually the number
if
one
you-
reason why we do these.
If you had to take it out and you couldn't brush it right away, you had to store it, and then you had to go.
Yeah.
And the smell of that thing. Oh my God.
Or you just have that tooth removed, chiclet.
There you go.
That's
Or
awesome.
yeah, I just get them all taken out and then like full on fake veneers put in.
Just full deal.
You could.
That
Let me
seems
think
a bit
about this.
excessive
Let me
for
think.
one
No,
tooth,
it's not
but
though. You're excessive.
I can't argue with that.
Dr. Dan Miller, you can find out more information about him and his practice. It's Valley Dental Works.
Plural. Yes. .com.
I was going to go out there actually Monday, but I was as sick as could be. So we thank you for coming in.
Yeah, we look forward to having you in the office.
And what's the website?
ValleyDentalWorks.com.
Okay. Well, I'm going to have a lot of questions when I get there.
I can't wait.
Thanks, Dr. Dan.
Thank you.
Don't move, 'cause